Namaskar. I am Dr. Arun Vadavi from Bangalore. Type 2 diabetes is a lifestyle disease. The unhealthy urban way of living is a primary cause for such a big explosion of diabetic patients in the society. Yoga is a way of living. Yoga is a very scientific exercise tool.
Ardha matsyendrasana. To do this, place your right foot to the outside of your left hip. Cross your left leg over your right leg so that your left foot sits at the outside of your right thigh. Lengthen your spine. Twist your body to the left. Bring your left hand to the floor behind you. Bring your right upper arm to the outside of your left thigh. You can hold the inner arch of the left foot or keep the forearm lifted straight. Hold this pose for up to 1 minute. Repeat on the other side. This is a wonderful asana for controlling diabetes as it stimulates pancreas, intestines, liver, improves circulatory and nervous system. Paschimottanasana. To do this, sit down, extend your legs straight. Inhale, pull your hands up, bring your hands down, try to touch your toes with your hands without bending your knees. You can use a belt to help touch the toes. Touch your forehead to the shin. Remain in this pose for 60 seconds with normal breathing. If you want to practice a therapeutic approach in terms of yoga for diabetes, here is the one yogasana for you. Seated forward bend is an excellent option for people with diabetes. It controls diabetes, reduces blood pressure, and balances insulin levels in your blood. It helps in weight loss. It can relieve stress, fatigue, headache, and anxiety. Salabhasana. This asana has been found beneficial in the treatment of diabetes, stomach and digestive disorders, low back pain and arthritis. It strengthens the whole body, especially the neck, back, chest and waist. To do it, lie with your abdomen on the ground, make a fist and keep your hands under the thighs. As you breathe in, lift one leg at a time. Then lift both the legs and your upper torso also. Lift your leg upwards without bending the knees using your inner thighs. Your weight should rest on your abdomen and lower ribs. Stay in this pose for a minute and then release. Dhanurasana. Bow pose is a cure to fatigue. It strengthens your abdominal muscles, reduces constipation, helps in regulating the pancreas. It is high in recommendation to balance the blood sugar levels. To do this, lie down on your stomach with your feet slightly apart, fold your knees up, hold your ankles with your hands. Breathe in, lift your chest off the ground, pull your legs up, stretch out. You should feel the stretch on your arms and thighs. Hold the pose for 12 to 15 seconds, paying attention to your breath as you take long, deep ones. Slowly, bring your chest and legs back to the ground. Release your hold on the ankles. Relax with your hands on the side.
Pranayama is an essential and integral part of yoga. In my experience, people who have been practicing pranayama regularly, their medicine load has come down and their blood sugars have come under control significantly in a very short time.
Bhastrika Pranayama. Sit in any comfortable posture, Vajrasana, Padmasana or Sukhasana. Keep the body erect. Forceful inhalation and exhalation from nostrils in rapid succession. Start with 10 inhalations and exhalations per round. The resulting hissing sound resembles blowing of the bellows. Do 3 rounds and you can then come back to normal breathing. Regular practice of this pose strengthens the immune system and keeps several diseases at bay. This pranayama massages brain centers and regulates metabolic control of insulin. This form of pranayama rejuvenates the body and keeps thyroid at bay. However, diabetes patients are required to do this under supervision on an empty stomach. Bhramari pranayama. This breathing technique calms the mind and relieves stress and anxiety. Sit in any comfortable posture with your spine straight and your shoulders relaxed. Apply the Shanmukhi Mudra. Apply light pressure with the thumb, fingers against the various sense organs. Inhale through your nostrils. Let your lungs expand fully. Exhale with a sound like a humming bee produced through your throat. Repeat the cycle. A variation 2. You can close your ears with the forefinger. Close the eyes. Take a deep inhalation and while exhaling, make a soft humming sound. Bhramari scientifically accelerates the release of nitric oxide, which plays a significant role in metabolic processes at the cellular level. It controls blood pressure, improves memory, boosts immunity. It also controls the hormonal secretion that inhibits insulin resistance. Ujjayi pranayama. On a bolster, fold your blanket into 3 folds. Lie down with your head resting on the blanket. This posture helps the practitioner to go into deep, relaxed, meditative state. Palms in Jnana Mudra, Chin Mudra. Take a deep, long breath slowly from both the nostrils. Try to contract the throat to make an ocean wave sound as you inhale. Retain the breath for a few seconds within. Now slowly exhale the breath as gently as possible. Repeat the practice. Ujjayi pranayama releases the tension, anxiety. Focusing on Ujjayi breathing can balance the entire endocrine system. Thus, regular practice of pranayama promotes significant improvement in several important factors associated in the management, reduction, and elimination of diabetes.
I recommend all my patients to take pranayama and yogic exercises regularly. Not only my experience, but even scientifically it has been proven that yogic exercises and pranayama help patients in controlling diabetes and other lifestyle diseases. As I said, diabetes is a lifestyle disease. Hence, correcting the lifestyle becomes the way of treatment for diabetes type 2. Not only this, even all scientific journals are now regularly showing benefits of yogic exercises, and that is why UN has adopted Yoga Day once in a year based on these scientific evidences only. So my final suggestion is that if you are a diabetic patient, practice yoga, practice pranayama, and see that your medicine load comes down. Thank you.